You think your loved one has dementia, but that is not always the case. My name is Abby Sakaraya. Today we're going to be talking about the difference between delirium and dementia. Dementia is an umbrella term for a chronic and progressive disease which impacts someone's ability to care for self and it impacts memory, cognitive skills, and dementia is non reversible. So it is a progressive disease. And there are different type of dementia. There could be early onset and late onset dementia as well, and also dementia as stages. And depending on the stages, depending on the severity of the disease process. And most people in the early stage of dementia don't even know they have dementia. They just can be missing appointment here and there. But when we get to that advanced stage dementia, which has a lot of memory loss, most people in that state, they are unable to care for themselves. But now I'm going to talk about delirium. What is delirium? Delirium is a sudden change in condition. It is acute and something that happened suddenly, and it is reversible. So, for example, delirium is like short-term confusion when somebody go to the hospital or they go to like a nursing home. They are in an unfamiliar environment, especially the older adults. They can have this change in cognition that is reversible. And as a nurse, I've seen this so many times. And I remember when I was a baby nurse, when I used to work in the hospital as a nurse, when I get report from my daytime colleague and they say, oh, the so patient is very alert and oriented. And when you see in the evening, they have this confusion where they're trying to get out of bed and they're saying, this is my home. That is what we call delirium. There are a couple of things that could cause this sudden change in mental status. One could be what I just mentioned, which is the change in environment, being in a new environment. Could be after surgery. It could be also medication side effects. For some medication like steroid could cause people to have delirium. Some antibiotic side effects could cause delirium. But the good news about delirium that it is now permanent. When the offending agent is gone, people usually return back to their baseline. So that is the difference between delirium and dementia. If you're not sure what your loved one has, if it's dementia or delirium, go to your doctor because, like I mentioned earlier, change in medication, sometimes even deficiency in some vitamin, like vitamin B12, could cause a change in cognition that is reversible. So, to seek help about delirium or dementia, the first line to do is to go to your doctor, go to your primary care doctor. And if you see a sudden change that is very acute, you can actually go to the hospital because infection also, like urinary tract infection, could cause delirium. If you want to talk more about this topic, go to cherishedhands.net.